What can falsely increase the arousal index reading? Have you ever wondered what might make the arousal index reading seem higher than it really is during a sleep study? The arousal index measures how often a person briefly wakes up during sleep, which is important for understanding sleep quality, especially in conditions like sleep apnea. However, there are several factors that can lead to a misleadingly high reading. First, let's talk about sleep stage variability. Arousal events are more common during lighter stages of non-rapid eye movement sleep. If someone spends more time in these lighter stages, the arousal index can appear inflated, even if there are no serious issues at play. Next, consider movement artifacts. Activities like teeth grinding or shifting positions can create muscle signals that might be mistaken for actual arousals. This can lead to a higher arousal index reading, even though the person may not have truly awakened. Snoring and partial airway obstruction also play a role. These can trigger small awakenings, known as microarousals. However, many of these events are normal and not necessarily indicative of a sleep disorder. This can also result in a higher arousal index that does not reflect significant sleep disruption. Technical and scoring variability is another factor. Different methods for scoring arousals can lead to inconsistencies. For instance, some scoring criteria might pick up on minor changes in brain activity that do not representing real awakenings. This can further inflate the arousal index. Medications and substances that affect the central nervous system can also increase the frequency of brief awakenings. If someone is taking certain medications, it may lead to a higher arousal index, which does not accurately reflect their sleep quality. Lastly, environmental factors like noise or light during the sleep study can cause increased arousals that are unrelated to sleep disorders. If the sleep environment is not ideal, it can lead to more awakenings, thus affecting the arousal index. In the context of sleep apnea, it is essential to differentiate between arousals caused by breathing issues and those caused by other factors. Arousal events related to respiratory problems are significant, as they indicate sleep disruption due to airway obstruction. Non-respiratory arousals can misrepresent the severity of sleep apnea, making careful interpretation of sleep study data vital. Understanding these factors can help in accurately assessing the arousal index and its implications for diagnosing and treating sleep apnea. By being aware of what can falsely elevate this reading, both patients and healthcare providers can make more informed decisions regarding sleep health.